All right, so the measles outbreak continues in a number of provinces here. Cases have been climbing, authorities urging parents to make sure that their children are up to date with their vaccinations and boosters. I'm joined now by Paediatrician Dr. Sanelisiwe Balfour, Nelly, as you are popularly known. And thank you so much, Doc, for joining us in studio. You do work at Nelson Mandela Children's Hospital here in Johannesburg. Just talk to me about what's been going on with measles. Is it one of our worst outbreaks in recent memory? Why the concern around measles?
So firstly, thank you for having me, Sally. We definitely have a measles outbreak in South Africa. The World Health Organization actually predicted that this would happen as a result of COVID for the past 2 or 3 years. Everyone being indoors, not being exposed to different viruses, bacteria, etc. So it was essentially what we call an immunity gap, and it's kind of the perfect environment for for communicable diseases to spread. So currently in South Africa we have a measles outbreak, with some provinces being more affected than others. So Gauteng, for example, has the highest number of new cases to date. And we're seeing that it's children who are mainly affected as opposed to adults. And then within children, it's the age group of 5 to 9 years. So we're seeing more and more numbers since the end of 2022, I think around November, and numbers are increasing daily, and it's turning into quite a problem.
So a lot of people say, I'm not going to bother getting my child the vaccine or a booster. I had measles as a kid. It's one of those childhood illnesses that we're just going to get through. Why all this panic about a vaccine?
I think it's mainly the complications that us pediatricians are worried about. So kids spread it to one another, and they can spread it to people who are immunocompromised or even pregnant women, which can lead to devastating effects. And complications we typically see in children can range from an ear infection to more severely pneumonia, meningitis, and even encephalitis, and subsequently death. So as much as people harp on about, they've had it when they were young, I mean, I even had it when I was young. However, we're seeing now that the numbers are increasing, and kids don't have much immunity towards the measles virus itself, which is why we are advocating for kids between the ages of 6 months to 15 years to get their booster measles vaccine, just to decrease transmissibility and to decrease the morbidity and the mortality that we've been seeing with measles currently.
A lot of parents were quite good when the kids were little and had those sort of regular vaccinations, and then by the time they get to sort of 8, 9, 10, 11, 12 and on, nothing's happened. Are you still covered to some extent if you had the raft of vaccinations in the first 2 years of life?
So we generally tend to immunize against measles under the age of a year, according to our South African EPI, or our South African immunization schedule. But what we have been seeing is even the children who are a bit older, who received their measles vaccine when they were younger, because of the 2 or 3 years of the immunity gap that we've experienced, where we haven't been exposed to pretty much anything, we're finding that even the older children are getting and acquiring measles, even though they seem to have gotten the vaccine and the immunizations when they were younger, which is why we are promoting, or advocating rather, that all children from the ages of 6 to 15 years still get it. Because we're still seeing that their immunity has somehow waned a bit, and they're still developing, they don't have any resistance whatsoever to the measles virus. So we are advocating that they still get the vaccine currently.
Is it leading to more severe cases of measles?
It is. Because again, the immunity gap and them not having enough immunity to measles, that we are seeing more severe cases currently. And just the number of cases we're seeing. We haven't really seen this many cases from pre-COVID times. And it's increasing every single day. I mean, you can find the numbers on the NICD website, and we are seeing, and as pediatricians, we are worried at the number of measles cases that we are seeing every day.
So what sort of numbers are we looking at in Gauteng, for example?
I think there were about 400 cases, if I'm not mistaken, in Gauteng, but the numbers are generally increasing, and it is something we need to take very seriously.
And what point, if you realise your child has got measles, at what point do you go, look, my child needs to get to a hospital? What are the signs to look out for?
So we basically say that the first 3 signs are the 3 C's. So these are the early signs of measles before the rash develops, because I know everyone typically talks about the measles rash, but there are signs before that. So the 3 C's are the cough that children tend to get, the conjunctivitis, which is the inflammation and redness of the eyes, and coryza, which is basically inflammation and stuffiness of the nasal passages in the nose. After that, they develop the typical rash that we see, which is a very fine rash, which is all over the body, usually on the face, body, arms, trunk, legs, everything. And that's associated with a swinging fever and a very high temperature. Also something that us pediatricians look for in children who come to the hospital just to basically diagnose or make sure it's definitely measles is something inside the mouth called Koplik spots. And this is something people don't know a lot about. So inside the mouth, basically inside the cheeks, there are these white dots all over. And that's basically typical characteristic of measles. So before they develop that rash, sometimes we look for that, and that can tell us whether the rash is going to develop and whether they do or don't have measles. So I think if parents are worried, the rash is usually what they typically come to the hospital for, and when they come and see us, because everyone pretty much knows that this rash might or might not be measles, and that's when they come and see us. But even when there's the 3 C's, I love empowering parents and educating them, letting them know what they need to look out for. So cough, conjunctivitis, and coryza, those 3. We also tend to see children at that stage anyway, because a lot of parents, think their child either has a lower respiratory tract infection, upper respiratory, cold, flu, etc. So they will seek medical attention at that point. But usually I would say to parents when they should definitely come is when the child has the rash, because that's usually characteristic of measles itself.
So to understand what you're dealing with, what do you say to parents who are hesitant about vaccinations? There was so much misinformation around COVID vaccinations, and there has been a growing, particularly in Western countries, concern fueled by many conspiracy theories. What do you say to parents who are concerned about all the conspiracy theories they've heard?
Please, please, please vaccinate your kids. So a lot of them are just that, they're conspiracy theories. And we as healthcare workers and pediatricians see basically, the worst part of children not getting immunized and vaccinated. The reason we're also in this situation with the measles outbreak is not just because of the immunity gap, but because during COVID, a lot of people didn't follow up on their childhood vaccinations and immunizations, which has led to this point of kids spreading these diseases to one another, which they should be immunized against. So studies have shown that, these conspiracy theories where some people think kids may get autism, etc., because of vaccines. Nothing has been proven. But what we have been seeing is that vaccines save lives, and what we want to do is save every single children's life out there.
Absolutely. And thank you so much for coming through to chat to us about a very important issue. That's Paediatrician Dr. Sanelisiwe Balfour. She's at Nelson Mandela Children's Hospital. Measles cases are on the rise. If your child is 15 or under, they should get a booster.